physicians must follow quality directives as defined by the Secretary or lose their business. Mr. Smith, are you aware of this provision in the law?
I'm not familiar with that section, no, sir.
Okay, well, let me ask you this then. In this provision, you may not know this either, but the word quality is not defined in the statute. So it's safe to assume that the Secretary, not just Secretary Sebelius, but every Secretary to follow, Republican or Democratic administration, will be able to define through regulation what that word quality means. Yes or no?
I believe that is the correct interpretation. I think quality, again, we have tried to introduce quality performances into a variety of parts of our programs, both in managed care, both in the fee-for-service world. Again, this is another one of our concerns that we're going to have state standards, then we're going to have federal standards.
Well, it's a huge concern of mine as a physician member, and I know very well what quality means in regard to the specialty of obstetrics and gynecology as defined by the American College. The same thing for the American College of Surgeons. The specialty societies define quality. If the Secretary decided to use this provision in the law under 1311H, and it's there very clearly, and she or any Secretary uses provision to determine, let's say for an example, mammographies for women under 50 did not improve their health care because of false positives, like her U.S. Preventative Services Task Force did back in 2009. You all remember that. Would a physician be able to treat patients in the exchange if they prescribed a mammogram for a 49-year-old woman? Well, can you answer that for me?
I don't think I can.
Well, I can answer it for you. The answer is no. If the Secretary decided that physicians who performed abortions were not practicing quality medicine because they endangered the life of a child, could the Secretary run providers who performed abortions out of business? And I'll answer that one for you, too. The answer is yes. Mr. Chairman, I believe that this language in 1311 would allow the Secretary to control what physicians prescribe, what health care patients can access. Is there a single person in this room who thinks that the Secretary should have that kind of authority, whether it's a Republican or a Democrat? Mr. Chairman, I have a bill, 6320, which repeals this clearly dangerous provision. And I plan to reintroduce this bill in the 113th Congress. And I hope that this committee, in a bipartisan fashion, can work together in this effort. Because, look, I don't know whether this section 1311, subsection H, was an intentional provision or unintended consequences. I would rather like to think, unintended consequences. But this is the thing you get in a 2,700-page bill that you have to pass and then finally find out what's in it. And maybe you'll like it, maybe you won't. But this clearly is a provision where any Secretary of Health and Human Services can pretty much determine what the quality of care is for physician providers in one of these exchanges in the 50 states and the territories in the District of Columbia, and any specialty, when each specialty society has clearly defined what is quality care. But yet the Secretary now can just say, well, you're not providing quality care as determined by me under Section 1311, and therefore you're basically out of business. You can't be part of a provider panel in the exchanges. This is clearly wrong and has to be repealed. And Mr. Chairman, I've probably gone a little beyond, but I'll yield back now and just remind my colleagues, H.R. 6320 just repeals that section, and hopefully in a bipartisan way we can get that done in the 113th. And I yield back.
The gentleman yields back. The chair now recognizes the gentlelady from Wisconsin. Ms. Baldwin, 5 minutes for your questions, please.
Thank you, Mr. Chairman. I am very proud of the work we did in this committee to pass the Affordable Care Act, because access to affordable health care is an essential pillar of middle-class economic security. Many states are making very impressive progress in moving health care reform forward. We've heard Maryland and Arkansas as two great examples of two states that have, it seems, put politics aside and are doing the very hard work involved in implementation because they know it's the right thing to do for the families and small businesses and others in their states. While these states have moved forward, and certainly others have across the nation, I have really been concerned about my home state of Wisconsin and the way it's been holding back. Earlier, Wisconsin returned an early innovator federal grant that would have enabled our state to build a Wisconsin-run health